We're here at the HIMSS 2023 conference, and our guest is Harsh Nayar from Pocket Health. Welcome, Harsh.
Thank you. Great to be here.
Yeah, so what is it that got you into healthcare IT, and what keeps you excited to work here?
That's a great question. Almost 10 years ago now, I was out in the Bay Area. I had gone out there to do my master's at Stanford, and I was playing tennis with a buddy. And I was playing tennis, I fell and I hurt my ankle. I sprained it. It was hurt. I went home that night. The next morning, it wasn't getting any better. So I went and saw my doctor, and she asked me to get an x ray and an MRI. So I went to the local imaging facility in Sunnyvale, California. At the end of the appointment, the technologist actually handed me these two CDs, one for my x-ray, one for my MRI. And here I am, smack in the middle of Silicon Valley. You got YouTube up the road, you got Netflix down the road, and apparently the state of the art in medical imaging to transfer digital information was to put it on a CD and hand it out to a patient. That's when I kind of realized there was something a little wonky, and maybe we should deal with it. Since then, we've come a long way. We've really realized that experience that I had is actually an experience pretty much every single patient goes through. Because, genuinely, almost every healthcare journey starts with diagnostics and diagnostic imaging. And so when you have imaging that's performed, you often have it done at one provider, and then as you follow your care journey, you go from one provider to a second provider, maybe even a third provider, and that imaging needs to follow. Yeah. And the way that imaging traditionally is shared is CDs, and some of the legacy image sharing vendors have sort of tried to create networks, and they really just introduce a lot of friction and don't really solve the problem.
That's awesome. Well, I'm glad that Pocket Health is working to solve the problem that you had. What is something that not enough people are talking about here at HIMSS?
Yeah, so really imaging. But I think if you zoom out, there's a lot of focus on interoperability, and within that interoperability conversation, a lot of folks are talking about interoperability between providers, but they're really not talking about interoperability with the patient, arguably the most important stakeholder in healthcare. And what we're really focused on at Pocket Health is making healthcare more interoperable for patients.